When it comes to non-stimulant medications, there are several approved for ADHD. These include atomoxetine, extended-release guanfacine, and, in the US only, extended-release clonidine. While the stimulant medications have an immediate clinical effect, the non-stimulants do not, and it takes several weeks for them to reach maximal levels of effectiveness. Atomoxetine is a specific noradrenaline transporter blocker. It's licensed for use in children, adolescents, and adults. As noted above, it takes several weeks to take effect, and there is some evidence to suggest that the maximum effect may take up to 12 weeks. Unlike the stimulants, where dosing by weight is not either effective or efficient, atomoxetine is generally dosed by weight, with an initial target dose of 1.2 milligrams per kilogram that can be increased up to 1.6 milligrams per kilogram, or actually 1.8 milligrams per kilogram in some countries, depending on response. There is, however, a maximum recommended dosage of 100 milligrams. Unlike the stimulants, which inevitably wear off in the evening, atomoxetine has some effect across the whole day and actually can be given either in the morning or at night. There is, however, some evidence to suggest that the effects are not even across the day. Effectiveness during daytime seems greater when you take your medication in the morning, while adverse effects are lower when it's taken at night. So the choice for different patients is really depending on the balance that you find for them. Guanfacine and clonidine are both alpha-2 agonists, which means they have a very different mechanism of action to all of the other licensed medications for ADHD. While clonidine is available as an immediate release medication in many countries, this preparation is actually of limited use because it has a very short half-life and would require multiple dosing during the day. The extended release preparations of both clonidine and guanfacine actually seem to be genuine 24-hour medications with effects across the whole day, irrespective of whether they're taken in the morning or at night. The general preference for them is nighttime doses, as this reduces the somnolence that can be associated with these medications. While clonidine in the US is licensed for children, adolescents and adults, guanfacine worldwide is only licensed for children and adolescents. This is because studies have not yet been conducted in adults. The newest ADHD medication to be licensed in the USA is viloxazine, a non-stimulant selective noradrenaline reuptake inhibitor that was originally marketed as an antidepressant medication. There have been positive clinical trials for children, adolescents and adults, and a license was granted in 2021 for all of these groups. These core ADHD medications are adequate for most situations. There are, however, several other medications with some evidence of efficacy that are sometimes used off-license to treat ADHD. In children and adolescents, there is some evidence for modafinil, an atypical stimulant-like medication with a complex and not fully understood mechanism of action. Also, bupropion, an atypical antidepressant that has been used to help smokers quit, has had positive clinical trials for ADHD in this group. For adults, there's also evidence to support efficacy for bupropion, and while there have been trials of modafinil in adults, the most recent network meta-analysis did not support efficacy of modafinil in adults. The last class of medications that I want to mention are the neuroleptics. And generally here we're talking about the atypical antipsychotics like risperidone and olanzapine. There's an increasing trend to use these medications as a treatment for aggressive behavior. And some people have started using them as treatments for ADHD. This is not something that's supported either by evidence or, in my opinion, by good practice, and really should be avoided at all costs. Now, having introduced the medications we use to treat ADHD, we will, in the next sequence, look in more detail about how they work, their mechanism of action.